So my first rotation, um, my CI was absolutely amazing. She was the one who really pushed my confidence, and she was the one that was, saying, even though you're small, you can do anything you want. She was also smaller stature, but in a sniff where you have to like carry patients basically. She boosted that confidence a lot.
Right.
And then my third rotation, my CI was also pretty amazing. He was the one that was kind of like, just relax, like be yourself. And then everything just started coming together between her and him. Like everything just is, that's how I am now.
Yeah, like it kind of mixed up. It,
Yeah.
it gave you the best of both worlds in the sense
Right.
of understanding like the tough love versus
Hmm.
not the tough love,
Right.
in the sense of kind of mixing that together,
Yeah. But
which
it
is
was a
good.
lot of finding confidence in myself and
Mhm.
understanding, like, yeah, you can do this. And then having people push you, like, to believe that that's true. And it
Sure.
wasn't just like, you're lying to me.
Yeah,
So,
yeah, of
yeah.
course. Was there a lot of pep talk to yourself during those times?
Absolutely. Even with not just myself, but with my friends as well. Because I think what I struggled with was I just went through so much failure in the past with, you know, how many years it took me to get into PT school and then all the struggles I faced while in PT school. And it took a lot of pep talks to believe like what my friends and family were saying, like you can do this, like your stuff, you went through this program, like you know what you're doing. And I just kept thinking, you don't know, like you're just saying that
Yep.
so I don't cry.
Right.
But yeah, once that clicked and I was like, I actually do know what I'm saying, then yeah.
I think that's the big part of it too, because until you start really seeing the patients, it makes the difference of like, I say that a lot, but textbooks can only teach you so much.
Right.
Humans are complicated,
Yeah.
especially patients who are like, ready to be done with therapy. Like
Yep.
they're even more complicated than what it
Right.
is. So I can only imagine, the situations that you've been in where they're frustrated with how their treatment's going and the progress that they're not getting.
Right. And it's definitely tough, especially being someone that's, 4'11, just barely passing 100 pounds. A lot of my patients obviously tower over me or they're a lot bigger than me. So it is scary. And I understand being in their shoes to be like, have this little girl walk in the room like, hey, I'm Justine, I'm your
Yeah.
physical therapist. Or at the time, like, I'm your student physical therapist, which student physical therapist, that's always going to scare patients because this is some of their worst times. They don't want to work with the student. So, on top of that, with my smaller stature, it's definitely scary. But it definitely helped me that everyone just kept saying, like, fake it till you make it.
That's such a big part.
It's such a big part. And then once I started, I thought I was just faking it and making it up, but it's like you do know everything. It's
Right.
in there. It's
Yeah.
just it'll come out and you just it's like, wow, did I say that? Like I didn't even know that I knew that.
Yeah. Yeah.
So, it's a
It
weird feeling.
it is a weird feeling because at some point, you're right. Like you think you don't know it, but you really do. It's just the confidence that has to build
Right.
up. And yes, sometimes you do have to reassure to the patient that you know what you're doing, and maybe you don't know it at that moment,
Mhm.
but it'll come to you. Like that's kind of what it is. And if it doesn't, well, that's your job to go figure out what went wrong or what
Right.
you can do to improve it.